Ever wondered what happens when severe pneumonia leads to pulmonary fibrosis? It's a battle that begins in your lungs. Picture this: the lung tissue, which is responsible for the critical task of respiration, starts to die due to severe pneumonia. Now, the body, in its bid to heal, replaces this dead tissue with connective tissue. But there's a catch. This connective tissue, despite its noble intentions, can't perform the respiratory function. Imagine it as a patchwork quilt, hastily sewn together to cover a gaping hole. It does the job of filling the void, but doesn't quite match the original material's function. This is what happens in your lungs. The connective tissue patches up the holes left by the dead lung tissue, but it can't breathe. It can't oxygenate your blood. And as this battle rages on, the lungs start to lose their elasticity. The once vibrant, flexible organs become stiff, rigid, and more susceptible to other diseases. As the lungs lose their elasticity, they become more vulnerable to other diseases. But what happens next when pulmonary fibrosis takes place? In the aftermath of this condition, the lungs undergo significant changes. The once vibrant lungs, bustling with life-giving oxygen, now bear the scars of their battle. The loss of lung tissue gives way to the growth of connective tissue, a patchwork quilt of repair, filling in the gaps where healthy lung tissue once thrived. This new tissue, however, is not designed for respiration. It's a simple band-aid solution, a quick fix to a complex problem. It lacks the functionality of its predecessor, leaving the lungs more susceptible to further disease. Yet, the body is resilient. Depending on the degree of lung damage, symptoms may regress. The body adapts, learns to breathe around the scars, to find new ways to absorb oxygen. But remember, the lungs are not what they once were. They are a testament to survival, to the body's incredible ability to endure. The lungs, once a haven for oxygen, now become a battlefield for survival. Are there any alternatives to conventional treatments for pulmonary fibrosis? Yes, indeed there are. Homeopathy provides a number of remedies that can help manage the symptoms of this condition. Let's delve into some of these. First, we have antimonium tart, a remedy known to help with breathing difficulties and excessive mucus, common symptoms of pulmonary fibrosis. Then, there's arsenic alb, which is often used for respiratory conditions and can help with the fatigue and coughing associated with fibrosis. Next up is bryonia. This remedy is known to aid in relieving dry cough and breathing discomfort. On the other hand, kali carb is a remedy that tends to be beneficial for those with weakness and shortness of breath. Last but not least, we have silicea. This homeopathic remedy is often used to help with chronic conditions, including those affecting the lungs, like pulmonary fibrosis. While there's no absolute cure, these remedies can help manage the symptoms and improve the quality of life.